Good morning, everybody. Bismillahirrahmanirrahim. Today we are going to speak about the history taking station in MRCPCH exam. And first of all, for those who don't know about this station is 1 out of 10, as we know the exam. The time of this station is 22 minutes, and they are divided into 3 stages. The first stage is the first 9 minutes. In these 9 minutes you should collect history showing your communication skills and how systemic you are in collection of data and your ability to extract the positive findings. And this is very important actually, because everything you are going to extract, you are going to be given a mark for that. And the last, the middle stage is 4 minutes, in which you are supposed to revise the history with the mother or with the role player, and to conclude it, and to check if you missed anything you didn't ask about. And finally, the final stage, which is 9 minutes. In this stage, the role player will go out, and you will spend the 9 minutes with the examiner. So the examiner should discuss with you according to the history you took. It's a very famous question. He will ask you what you want to do for this patient today, and it's short question, but you have to include in your answer what you are going to do. You should start by doing examination. You cannot just depend on the history. So it's very tricky question. You cannot just say, okay, I will do CBC, UE, all these investigations. It's not acceptable at all. You have to mention that I want to take full history and then to examine, and after that you will proceed with the investigations and treatment. That will be discussed later, but as we said, they are 22 minutes. The most important thing in the first 13 minutes is to show to the examiner your ability to collect and take history in a very organized, systematic approach. I hope that during this recording we will be able to collect all the findings which is required in this station. So we can divide this station, okay, to certain requirements. You will be asked and you will be given marks based on these requirements. You have to show to the examiner first your good communication skills, then, as I mentioned, systematic approach in collection of data. You are going to be given marks based on the full extraction of all positive findings. And the final thing, which is the discussion, you have to show your knowledge, how knowledgeable you are, and you are going to be given marks for your ability to summarize, and the final discussion regarding the management planning. As we know, this station, history taking and management planning. So first of all, history taking, there will be letter given from GB, giving concise history, few lines, about a certain complaint, and we can divide the history taking into two categories, whether it's acute case, like a new case which not previously diagnosed to have any problem, or acute on top of chronic. It will be something related like complication to a disease or complication to the medication of a disease. These are very common in or complication related to incompliance to medication, like diabetic patient who's not taking insulin, so he's known to be diabetic, and the new issue that he's having DKA, so it's a complication which is the main cause is incompliance to medication. Or acute of chronic nephrotic patient who starts to have vomiting of blood, and then we discover that this is related to the steroids he's taking, or he had like abdominal pain, so we'll think about the complications of nephrotic syndrome, like mesenteric thrombosis or thromboembolic events. Or we can say like patient who's having cystic fibrosis, and now he's presenting with pneumonia or ARDS, or patient who's having spastic CB, and the new complaint is convulsions, something like this. So I have to be cautious if the history is related to a known disease, and the new complaint is regarding a complication of this new, a complication of this known disease. Like, for example, diabetic patient since 2 years diagnosed, but the new complaint that he's having persistent abdominal pain, or he's having abdominal distension and weight loss. So it's very important that I'm going to focus on the new complaint, and then I'm going to discuss the disease itself, how and when it was diagnosed, but that will not be my complaint or the present history. I should be very focused, because some of us commit this mistake. When the history is related to a diabetic patient who's having or starting to have abdominal pain, then they will start the present complaint by asking about polydipsia, polyuria, when the diabetes was known, and what was done so far, and what medication is on, and we forget the analysis of the complaint itself, which is the main concern for history taking, is to focus on the new complaint. So as we know, any history taking, it will start by present history, and we should know that in present history we are concerned about the complaint, and I should know clearly that there are certain complaints which are very common in exam. To prepare for MRCPCH exam history taking station, I have to be ready for prepare myself for certain complaints. I have to be ready with certain differential diagnosis for each complaint. So let's assume that complaint is cough. Okay, so I have to differentiate cough according, is it acute or chronic causes of cough, and I have to know that the different etiology of cough, is it infection, is it like cardiac cough, is it like a medication, okay, is it something like structural, congenital, is it like foreign body, okay, so, and infection, is it something acute or chronic as well? So I have to be systematic in analyzing the complaint. So first of all, I'm going to extract the complaint from the letter which I received from the GB. So if we said cough, so I'm going to differentiate different causes of cough in my mind, and I'm going to stay 4 minutes before the station. I will be given a plain paper with the scenario of the history or the letter received, and what I'm expected to do, that I'm going to write down the name first. Don't forget, never forget the name of the patient and name of the parent, okay? And then I have to focus on the complaint, and after I focus on the complaint, I'm going to put certain differentials for this complaint in the paper so as not to forget, and prepare the characteristic questions which I'm supposed to ask for this complaint. Is that clear? So let's say, for example, the complaint is headache. Okay, so I have to know myself that according to the history, maybe it's vague, the complaint was only headache, so I have to differentiate the different causes of headache. I know that it could be migraine, the dangerous signs of headache like increased intracranial tension, and how to ask about it. Okay, the characteristics of headache related to increased intracranial tension. I have to ask about sinusitis. I have to ask about trauma, visual, constipation, okay, hypertension. So I'm going to list all the differentials for this, because that will help me when I'm going to take the history, what to ask and what to suspect based on the answers of the word player. Okay, so present history, let's say, as I mentioned, headache. So what I'm supposed to do, headache is a pain in the brain. Okay, so analysis of pain, it will be intensity, okay, site, character, reference, relieving factors, exacerbating factors, and affection on lifestyle. So if I'm talking about pain, I will mention all these items. After I analyze the pain like this, okay, so there's onset, cause, duration, when it was started, is it like something stationary, increasing, decreasing, and for how long, okay? And then the other specific questions, and then I'm going to ask specifically for each differential diagnosis I'm putting. So if I'm suspecting migraine, I have to ask about aura symptoms and relation to diet. Is it exacerbating a certain type of diet, like chocolate, for example? Okay, as we know, it is increasing or enhancing the migraine pain. Okay, so for example, ICT, so I have to ask about when, if there's preference of this pain, it comes in the early morning, is there any association with projectile vomiting or not, and how severe it is. Okay, so I'm asking about sinusitis, so I have to ask about if there is any fever, if there is any discharge, nasal discharge, and the site will be characteristics for sinusitis as well, and relation of the posture. It's very important to ask about it. Okay, hypertension, how can I ask if it like pulsating headache, and the site usually in the temporal region, and I will ask if she has any medication for hypertension or known to have hypertension, visual. So I have to ask about if she or he faces any problems with vision. So based on my differentials, I'm going to ask about each one, and I have to be cautious to select the most characteristic question for each differential so as to be concise. Clear? So after that, I'm going to ask about the related symptoms. Okay, so what are the related symptoms to headache? For sure, I have to ask about related symptoms, seizures. Okay, so seizures are very important. Eye symptoms like blurring of vision. Okay, so what else? As I mentioned, vomiting. If I didn't ask, so I have to think about it when I'm asking about the related symptoms. Okay, nasal discharge in case of sinusitis. These are the related symptoms. And after I ask about the related systems to the complaint, I have to take systemic review. And the advantage of taking systemic review is not to miss any possible differential diagnosis I didn't encounter. And again, it's very common for us, actually, it's this mistake that we are going to take systemic review sometimes in a very pragmatic manner, which gives the examiner bad impression about us. So he will think that we're just reciting, and it's not like taking the history in a very intelligent way. So how can I take systemic review? It will be from here to two. So I should think about the related symptoms. So let's say if this headache because of autoimmune cause, and one of the common in lupus, for example, lupus nephritis, that hair loss. So I have to be cautious also to justify. If the examiner asked me, why you ask about hair fall? Okay, and I didn't think about it, I didn't justify it, so that will give a bad impression. So I will say, for example, he's having hair fall. If there's any hair fall, that will be justifiable that time if I mention about lupus nephritis, for example. That will be one of the differentials. And then I'm going to ask here, then I have big eyes. Okay, so if there's any injection, blurring of vision, nose, if I didn't ask about nasal congestion before or nasal discharge, I'm going to ask here. Okay, mouth, if there's toothache, okay, that will cause headache as well, and for sure we agree that it will cause severe headache. So if there's any dental caries or any problems with the teeth, okay, and ears, for sure if the otitis media can cause severe headache, labyrinthitis. Okay, so and then I'm going to take chest and heart. So any patient is having problems like hypoxemia, chest, he will have headache. So I'm going to take system in this order. Okay, heart, if he's hypertensive, he will have pain. Okay, headache, sorry. If this patient is having constipation, he will have headache, so GIT. If this patient having UTI, he will have headache as well. Okay, with fever. If this patient is having any muscle pain or muscle ache, that will cause pain, so you have to ask about musculoskeletal. If lupus, he will have also muscle, skeletal pain and or articular pain, as well as skin. So I have to ask if there's any skin problems, if there's skin rash, something specific, and I can justify or associated with infection, encephalitis. So skin rash is very important. So in such way, and CNS, for sure, CNS, I have to ask about it earlier because not accepted for the complaint to be about headache and not to ask about CNS. Okay, why CNS? Sometimes, as we know, migraine, there's hemiplegic migraine, so I have to ask. Okay, and if seizure can happen with headache, if there's something like focal brain mass, so increased ICT and also headache and some focal symptoms, so I have to ask about CNS. If there's any diminution in the power in one limb, or if there's any seizure or increased tone or spasticity in one side, tone, let's say tone, or stiffness. So I think things now is more clearer and it makes sense what you are asking about and how can you justify it. So we finished the systemic review. Just to revise what we discussed about for the time being, we first talk about the history taking station, overall how that it's 22 minutes and how it's divided into different stages, and what you are going to do within the first 4 minutes before you log in for the examination station, and you are going to read carefully the referral letter from the GB, and to summarize, or I mean to focus on the complaint and put some suspected differential diagnosis for this complaint, and what are you going to ask and how can you ask for each one of them. And if you have time within these 4 minutes, you should also think about how can I diagnose this one, so what's the investigation and the treatment for each of them. That will be helpful for discussion, and I think you will have time inside to think about. Okay, and then we talked about the how can we collect, so the collection of the data, starting with present history and complaint, analysis of complaint, onset, course, duration, and we discussed about headache, for example, and we said how can we analyze headache, and the same for pain. Let's say analyzing cough, so cough, I have to ask about the character of cough, okay, also severity of cough, time preference during night, during posture, okay, and discharge of sputum, color of sputum, amount and color, very important, and any associated symptoms with cough, fever. So it makes sense for each complaint to prepare and to memorize these different questions you are going to ask for each complaint. Like vomiting, for example, so also relation to food, how severe, is there a certain time, and bilious, non-bilious color, projectile, non-projectile, very important, and each question has or its indication for the different differentials. Okay, same for constipation, same for diarrhea, and so on. Then we discussed about associated symptoms. So if I'm going to, or related symptoms, if I'm going to ask about abdominal pain, so the related symptom will be constipation or diarrhea, vomiting. It should be screened. Also cough, so related symptoms will be respiratory distress, tachypnea, and anything related to the chest and heart as well. Same for the headache, as we mentioned, CNS will be the related symptoms as well. System. So I think now things are getting more clearer. Now we just mentioned about the systemic review, taking like screening questions from here to 2, and how can we justify each question, because it's very important for the examiner. Some of them does not like, or some of them don't like this when you are doing the systematic review. They will think that you are just stuck and trying to fish diagnosis. But as I told, you yourself should think about each question, and is it related? It can be something related to this complaint, and how can you justify it? If you find yourself not able to relate this question to the complaint, so don't ask. Okay. Then the past history. Past history, I should ask about, okay, any similar illness before. Okay, I should ask about hospitalization. Each hospitalization, how long, how severe. How severe means, did it require ICU admission, for example? Okay. What medication was given during this admission? What investigation or tests were done in each one of them? Which teams saw the patient during each admission? What were the discharge medication for each admission? Clear? So I'm expected to answer all this, or to get answer for all these questions in the past history. Then, after fulfilling this, I have to ask about the current medication history. I'm going to take it as single identity, because it's very important in certain diseases to ask about what are the medication right now and to assess compliance. So let's say a patient is taking dexamethasone, for example. I have to check what is the dose, how frequent this medication is getting, and I have to know the side effects of the drug to ask if there are any symptoms or complaints related to the medication. Clear? So after taking the medication, and we talk about hospitalization, history of investigations, team. So then allergy, very important, not to miss allergy, and it has to be single identity. And allergy, including the different types of allergy, it's not only the medication, it can be food allergy, history of anaphylaxis, anything. So don't focus only on the medication, okay? Especially that sometimes the complaint is mainly related to asthmatic patient. So the allergy part will be the primary part to include in your present history. Then I will take these coming identities in this order so as not to miss, but again, in some situations, one or two identity is not important at all to be asked, but it will be like just tick over each one if you ask it or not, because according to fulfilling these identities in the exam, you are going to be given mark for fulfilling these criteria. So after I mentioned allergy and after the past history, I have to include, okay, in this order, first prenatal history. Prenatal history means maternal and antenatal care and all these maternal problems and how can I relate it to the history. And then natal history means during delivery, Apgar score, and for sure that will be very important in case of CB, for example. Okay. And then postnatal history, and means if the patient was admitted in ICU or required ventilation, like a patient who's having a chronic lung disease, patient who was having congenital heart disease and required intubation in early life. So ICU and what's related to the neonatal period, like patient cystic fibrosis who had delayed passage of meconium, so I have to mention here. And after natal, prenatal, natal, postnatal, I'm going to ask about vaccination history, very important, nutritional history, and in some cases nutritional history itself is the primary complaint, like a patient who's having failure to thrive. Okay, so nutrition history will be a very important role in our history. Okay, and then I will have developmental history, very important developmental history to ask about. And developmental history, especially if I'm talking about infant or child, and if I'm talking about teenage, so I have to ask about adolescence history as well, and puberty and all things related to this period of age. Developmental history, if there's any, like the complaint is delayed walking, so I have to ask specifically on developmental history, and I have to be aware about what to ask. So developmentally, I have to ask about motor part, I have to ask about social part, and motor is divided into fine motor and gross motor, social, hearing, speech. These things I have to ask about, and I have to know the milestones for each, and I think that will be easy for you after you study the developmental station. And then social history, okay, very important, social and economic history, very important, because sometimes this patient is incompliant to insulin, for example, and having repeated admission to ICU because of diabetic ketoacidosis, and the main problem that mother cannot afford insulin. That's why they are incompliant. That's why the main problem will be mainly social, and the management plan, you will start by mentioning the social services here. So social history and financial history is very important. How to ask how many bedrooms, salary, is it sufficient for all requirements of life, and if they are suffering from any debts or they have some financial commitments, and if they want help or not. Okay, and who's taking care of the kids, how many kids in the flat, and what's the condition of the housing. Okay, and finally family history. If I didn't mention before, I can mention here. Family history means any similar illness in the family, and positive or negative consanguinity, and what is the degree of the consanguinity. Okay, I think by reaching this point, you fulfilled the all required steps for completion of history taking station in the first 13 minutes, or let's say the first 9 minutes. So in the last 4 minutes, what you are going to say in these 4 minutes, that you are going to again to revise with the mother the history, but this time you will tell the whole findings you collected in an organized way, and you ask her to stop you if you mention something which is not clear or something wrong. So I'm going to ask, okay, as I understand from what you told me, Mrs. Aisha, that your son Muhammad, who's 3-year-old, and he was referred from Dr. Mustafa with a complaint of headache since 3 days, as I understood that this headache is blah 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 blah, and you have been seen in your regional hospital by Dr. Mahmoud, and he required like a CT scan, but unfortunately it's not available there, and he did some tests which came negative, and he discharged you in paracetamol or Panadol or whatever, and the different findings, any positive findings you are going to mention here, and you came here for follow-up or evaluation for this headache. And as I understood that, as I mentioned, you are going to say only the positive findings and to confirm that. Okay, clear? Then management planning will be as following. First, you are going to summarize what you just revised to the mother. You are going to summarize in a 3 or 4 lines maximally to the examiner. Today I have seen Mrs. Blah 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 blah. She came with a referral letter from Dr. Blah blah blah, and regarding her son, who's and again you are going to do this, but you have to mention only the positive findings. In summary, you are not allowed to exceed 3 lines. 3 lines are enough, more than enough. And there is a question very common in this station. The examiner will ask you, so what do you want to do for Muhammad, or whatever the patient name, what do you want to do for him today? Okay, so as I mentioned earlier, this is a very tricky question. So I have to mention first, I would like to, after I complete full history taking, I would like to do full neurological examination, for example, if it's headache, and then other systems, general examination, and I will do blah, 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 like this. But I forgot to mention that first he will ask you, so what's your diagnosis? Before this, what do you want to do for him? Sometimes you ask what you want to do for him, so then you will mention the sequence of the steps based on the differentials you put. And according to the differentials, you have to put first the first differential diagnosis. According to the sequence, it has to be the closest differential for the given scenario. If you mention anything prior to what's supposed to be mentioned, that will be deducted from your mark. So you have to be very cautious about the first differentials you are going to mention, and you have to say what is with and what's against, and how can you confirm this. So you will say, I would like to do examination, in such case I will find in my exam blah 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 blah, and I would like to do the certain blood test, which is, and you will mention the blood test based on, first there are initial basic workup. Don't just say CBC and electrolytes and all this stuff. You have to mention why you are doing, and is it really related or not. So anemia can be cause of headache or dizziness, so I have to mention that CBC, or infection, maybe this patient having sinusitis, so maybe the CBC will give me a clue regarding that problem, and electrolytes, maybe it will be helpful as well. So I have to be selective to what I'm going to tell, It's not only I'm doing because I have to do, you have to justify why you're doing these investigations. And the order, don't say I'm going to do CT brain the first thing, because usually we are not doing this in our practice. So think first, what's the initial thing I'm going to do, and then what's the investigation of a choice I'm going to do. Concentrate on the question the examiner is asking you, and finally what you like to do for him today, as we mentioned in this sequence. And the management, you have to mention about multidisciplinary team, starting by who's the primary team should be the responsible for the complaint and for the disease, and the other systems I have to refer to them, alert them, and according also to the order of the systems, I'm going to be given a good mark based on that. So if the main problem is the financial, they cannot afford the insulin. So the first thing to mention is social services to afford. If I have problem with the child abuse, so social services would be the first to be mentioned. If the patient is spastic CB and they're having a problem with increased stiffness or whatever, so physiotherapist and then neurologist. So I have to think about the order, very important. And I think if you follow these steps, the chance to get clear path is very high. And in this scenario, I think that if you try to provide the whole answers without waiting for the examiner to ask you, it will give a very brilliant impression to the examiner that you are confident, you are well prepared, and you are ready for any question he's going to ask. And even if you committed any mistakes, you will be forgiven, because the way you are exploring your skills and showing your skills, how you are taking the history, the sequence, the organized way, that will be more than enough for the examiner, and he's going to ignore any mistakes you may commit because of confusion or maybe lack of sleep. Thank you for your listening and your attention, and I hope that we will meet in the next recording, and it will be about communication. Thank you.